Gigi has been getting quite often when it comes to drug searches and formulary questions. Now, all of you should have and had already been exposed to the formulary list, which I am going to put into the chat message here, so everybody can get a copy of this PDF. The first thing I'd recommend to everybody is that you're sending a copy of this PDF to all of your sales. As you know, educating our clients does help alleviate a lot of customer service issues. A lot of the customer service issues that everyone's dealing with currently is in regards to utilization of the policy. So first, what I want to do is I want to make sure everybody's got this formulary list. Everybody is conscious that this formulary list exists, how to utilize it, and then we're going to use an online tool, which I'm going to expose you to if you have not been already, which is going to talk about My Prime. Now, the My Prime program is the pharmaceutical arm of Florida Blue Policies. They take care of all of our drug needs. If anyone has a question or anyone has a problem with their medications, in contacting Florida Blue directly, they are always referring to Prime Therapeutics. Prime Therapeutics takes care of our drugs for our older folks, our Medicare beneficiaries, as well as our under 65 clients. Now, in the past, as you know, many of our clients that have had Florida Blue, we didn't have to deal with this so much simply because, well, quite honestly, if you took many medications, you weren't going to be getting a policy anyway due to underwriting. But now, with the new wave of health insurance and being able to help everyone, we have people that are actually taking medications, believe it or not. So, you want to make sure you send everybody this list, but then also in your conversation with folks, you are able to utilize the My Prime website and to show estimated costs and tier recognition so that way your clients have a good understanding of how each of their medications are going to be treated. And this is very important because you want to manage the expectations of your clients and making sure you're picking the correct plan that is suitable for their drugs. Because if you pick a plan, for example, that has drug coverage post-deductible and someone is taking quite a bit of medications, it's probably not the right plan selection. So let's go to My Prime, and it's myprime.com. When you get here, there is a button that says Continue in without signing. You'll click on that button. Now you need to find out which policy we're looking at. We are looking for Florida Blue. Then, are you a Part D member, yes or no? If it is a Medicare beneficiary, MAPD plan, Part D prescription drug plan, this would be yes. For our Affordable Care Act plans, that's a no. We're going to continue to My Prime. This will load, and then you will be having the option to look at My Prime Mail. Now, that is where your clients can set up and arrange all of their mail order pharmaceutical needs. And then also, what we're going to do today is we're going to find drug and estimates. It's going to bring you to Florida Blue, and it's going to ask you what type of formulary are you looking at. And we are utilizing a 3-tier open formulary list. So what would happen is after you select that, you type in a few letters of the medication, it will bring something up. For example, Synthroid. Now, the reason that I picked Synthroid is because Synthroid is a brand name medication. And the reason that we are going to talk about the brand name medication is because, as many of you know, as we're dealing with Medicare style policies, they would pay the full cost of the drug if that full cost of the drug is less than the copay. So, for example, if the brand name copay would be $80, then what would happen is we would look at the Synthroid and we would say, well, your Synthroid is $80. Well, that's kind of and absolutely incorrect. So for the reason why I know that is because if we click on Synthroid, we hit select, we then select the package size that we are looking at, and we hit continue. It is now going to bring me the estimated cost of that medication, and as you can see here, the estimated cost or the total cost is going to be $30 a month. So if it was a brand name medication that was illustrated having an $80 copay, but the full cost of the drug is $30, they would pay $30. Now, for this particular medication, it's a non-formulary medication. So you can see here it's going to list if it's on the formulary or it's not. And then you would be looking at the formulary list here to identify what the treatment of that medication would be. Now, this is really a great tool for you to utilize. It does give estimated prices. It's not as robust as the Medicare.gov site would be when we're looking for cost of medications based on chain pharmacies and different things like that. So this will give you a very good idea of how to, what those drugs are going to cost and how to manage the expectations of your clients. Additionally, down the bottom of this page, you're going to see medication guide, which is a printable format, but that's going to be the same guide that we're looking at here that I've put into the chat function for you. Now, if we explore the formulary a little bit further, you're going to see some very important things. One is going to be Responsible Steps program, and that is basically a stepped therapy style program to where they may be required to try our less expensive medications before trying more expensive medications. And with that responsible quantity program as well, that is for responsible levels of medication. So, for example, if your client is taking, 15 Oxycontins on a daily basis, that might not be a responsible quantity. And in order for that person to fill that particular medication, they would need special documentation from the physician. This is going to explain that in the formulary list. There is a quantity limit authorization form right in this document. So this document is very important that you're utilizing it, sending it to your clients, because it is also what we would refer to as an active document, meaning that there are links within this document to get you what you need. So prior authorization forms, responsible step medications, so on and so forth, are all located in here. And this is very important that you're going to make sure that you're utilizing this, you're talking to them about that, and that they understand it. All right. So that's come up a lot. I hear the phone ringing in a lot of those conversations. Does anybody have any questions about the MyPrime or the formulary guide that I've just kind of gone through? Or does anyone need me to explore that a little bit further? Is everybody awake? Okay, moving on then. So let's talk a little bit about My Blue Service. These same areas are also available on My Blue Service. Once your client has enrolled and has a contract number, I want to urge all of you to make sure that your clients are going to the Florida Blue website, going into the member area, and registering. This is very important because in this area is a space where they can pay ongoing bills. They can see all claims. They can see estimated prices, physician searches, prescription searches, all of the tools that you would think a client would need. Once they get a contract number, they can log in here and register. Okay? So I need everybody to make sure that they're describing that to their clients and making sure that they understand how to use My Blue Service. Explanations of benefits are going to be here. It is a very useful tool, and you need to be guiding your clients through this process. As we've been identifying through the through Affordable Care Act really getting going, we are seeing a ton of service-related issues, more than we've ever seen before in our lives. And typically what we've dealt with is that once you write a policy, they would utilize the insurance carrier for a lot of these service-related issues. Well, with those service-related issues now, they are calling you because they can't get through to the carrier, because with over 160 to 170,000 people enrolling, they are spread thin. There are a lot of questions going on, billing questions and things like that. So in an effort to ease some of those service-related areas, we want to make sure that you're informing your clients with the proper tools. And those tools are going to include some very basic things: a summary of benefits, first and foremost. We are going to talk about a medication guide, which we also want to make sure we're sending them. A provider search, which we're also wanting to send them as well. And then, of course, your subsidy determination letter with contact to the government. So that way, if they have any questions about changing subsidy levels or things of that nature, they can make those changes without your involvement. So these are all some areas in an effort to try and ease some of those service that you guys are using and dealing with. But also be mindful that we have the Florida Blue Store. The Florida Blue Store is a direct service channel that you can use. They will help your clients with making payment. They will assist your clients with doing certain things. Now, When we're talking about them selecting and taking payment, they are using the same areas of making a payment at the Blue Store that we are using. So if your client walks into the Blue Store and they say, "Yeah, we can help you make that payment," all they're going to do is get HPS, the payment methodology, on the phone and make that payment over the phone. They're not actually collecting that money there. But know that after your client is enrolled, you can feel comfortable if you have a Blue Store local to you to let them go there for a lot of their questions and claims processes and things like that you are not able to help them or assist them in. Because we do need to spend our time wisely in selling rather than dealing with a lot of these service-related issues. Because at this point, with, call it 30 days left to do this, enrollment window closes, we are not going to be selling in the capacity that we are now. So we want to make sure that we're using this time to offer and get as many contracts enrolled as possible before the end of open enrollment is upon us. Excuse me. Okay, let's talk a little bit about payments. There are a lot of people that have not paid their second premium payment. Those folks need to make sure that they're calling. Tomorrow is going to be the cutoff for premium payments for a 3/1, for a binder payment. So someone who has a 3/1 effective date needs to call the 800 number to arrange payment of the binder if they have not made it. Now, if they have not made this binder premium payment and they miss the 3/1 cutoff, then they are going to have to re-enroll for a 4/1 or 5/1 effective date. I have not heard any grumbles about an extension on the payment for this year. Excuse me, for this month. It feels like a year, but for this month. So if that does occur, we'll let everybody know. We'll get that communication out to everybody. But for now, know that if your clients have not made binder payment for 3/1, they have to do that. For those of you that don't have the 800 number, I don't know how at this point. However, it is 1-800-950-3577. That number can be called 3 days after an enrolled policy if payment was not submitted with the application. If payment was submitted with application, then you should be fine, and you shouldn't have too much to worry about because you do have clear documentation of this. However, if they were not able to make premium payment at the time of application, 3 days later, they can call this 800 number that you see on your screen now, use option 1, and make a binder payment. They also can make a binder payment through an online portal, and through that online portal also you should have, and it is on your screen, to make that binder payment. Secondary payments, a lot of folks have not been making their second payments as we've been getting notification from Florida Blue, and you need to instruct your clients that they need to call this 800 number to make the second payment as well. If your clients are not making their second payment, they're going to go into a kind of a soft cancel and grace period, and then if they don't make that payment policy will be terminated, which will not give them an SEP to re-enroll. In conversations with Florida Blue, the number of people not making second payment is very large. So we do want to be conscious of that, and we want to have good communications with our clients. I would assume that everyone on this call, agency management systems are working. You have email marketing that you'll be using, and I would advise having your social media or having email marketing that is going to explain in detail these processes of making second and third payments. If you are not using any type of email marketing, then you need to start. You need to make sure that you have a good level of communication with all of your clients and some type of email system that will allow them to simply make payments and keep that reminder until they set up APO. APO, or automatic payment option, needs to be set up through the same 800 number and advise your clients to do so. Many clients, as well as agents and agents in your agency offices, think they set up APOs. I can tell you right now they did not. With the application, there is no mechanism to do that, so you can't. So they have to call the 800 number that you see on your screen to set up secondary payments. So very important with those payments, because if people don't continue to pay, then you're going to experience chargebacks, and then you could be in a situation where your client is not able to re-enroll because they've passed the enrollment window. Just to give you an example, we got a few calls yesterday, people that didn't pay their 2-1 premiums, and now we're in a situation where they have to make those premium payments. Also, people who submitted a 1-1 application, let's say in December the 3rd, they submitted an application for a 1-1. They didn't make binder payment. Well, those people are fine, because all we'll do with them is re-enroll them for a 4-1 effective date at this point. Not a problem. But remember, if they've paid and they've exhausted their initial open enrollment opportunity, then they will no longer be able to enroll again without a special election. All right, let me address some of the questions that come in here. I haven't gotten any leads in 2 weeks. Are others experiencing that? You'd have to talk with your agency owner regarding leads, lead companies, and things like that. Let's just see. Can I explain what it means that Florida did not expand Medicaid? Getting several questions about people who make too little for a subsidy but make too much for Medicaid. Well, what happened was Medicaid was expanded in many states that elected to do that, to where Medicaid would cover people up to 133% of the federal poverty level. So in Florida, what happens is the Affordable Care Act is recognizing and giving help to people that is between 100 and 400% of the federal poverty level. People that were in states that did not take the expansion would not be able to access the Affordable Care Act if they made under 133% of the federal poverty level. So if they don't qualify for Medicaid, that wouldn't have assisted them, because they'd probably be under the threshold for Medicaid assistance anyway. And also, if they're a man, they're probably not going to get Medicaid. It's really for most of the ladies and children of low income are the ones that are affected by that, and really get that help. I don't know if that explains what your question might be, but I think that kind of hits it on the head for what we all need to deal with and what we're doing. Okay. Next question: can employers pay for their employees' individual health insurance plan? No. They cannot. They can set up a program such as a Section 105, which we'll be talking about in our later in the month calls with everyone, but they cannot pay for that policy legally. They can pay for it, so let me kind of take that one step further. They can pay for it if they want, but they don't get a favorable tax treatment for doing so. So if I paid for, or Gigi paid for my policy, for example, she could pay for it all day long. She's such a nice lady. She would do that for me. But if she tried to write that off on her taxes as my employer, that wouldn't work. And it would work, but eventually the IRS would be knocking on her door. So be careful of that. It doesn't qualify for favorable tax treatment. I rarely believe my clients when they call and they say they never received a monthly bill, but I've gotten a lot of calls saying they have not been billed for 3-1 coverage. New business, but monthly bill. Not new business, excuse me. Is that common problem right now? Just concerned about clients that aren't proactive about calling in payment if they didn't get a bill. I don't know 100% what the billing cycle for mailing is right now. That hasn't been completely on my radar. Bill, what I would advise is that you contact your clients, tell them to call the 800 number and set up an automatic payment option, and then they won't have to worry about getting a bill. It'll be an automatic EFT into their account. All right. Once the contract, once they get a contract number, I'm assuming, is that the first hurdle we have to overcome? I don't understand the question. I'm sorry. So, Will, let me see if I can unmute your phone and maybe you can. You're on the regular. Will, what is your question? I don't know if I don't understand here. It's okay. It's early. I gotcha. No, there has not. So if someone has, when you say they made a plan change, what do you mean? So you mean that they purchased a Blue Select and now they want to switch to a Blue Options, or they bought Cigna and now they switch to Blue Cross? Right. Um, yeah, that is an identified problem for people who have done that. We're trying to get some resolution on. Was that a 3-1 effective date, or is that a 2-1 effective date? What I would do is, if you want to get those specific examples, and I would need app ID number, and this goes for everybody on the call who is having that. App ID number, a basic information of what's going on, with a reference number that you called for to Florida Blue on. Then what we can do is we can send that up for further research. Have you escalated it with both the healthcare.gov as well as Florida Blue, Will? Okay. Yeah. Unfortunately, there's some communication issues. I have to laugh because I'll cry otherwise. When those changes were made, and how that information is being parsed over from the government to Florida Blue, and how that is engaged with them getting and seeing the right plan at HPS. We hopefully will have some guidance on that. I've been working on probably a dozen to 2 dozen cases that are in that similar boat, and what happens is that there's just no clear definition of why it's happening, unfortunately. So, the government is blaming Blue Cross. Blue Cross is blaming. It's a big blame game, and unfortunately, the client is caught in the middle. If there may be some resolution that we can pass on to everybody. Obviously, if a 3-1 effective date is necessary, then we have to go through the healthcare.gov channels, just as you've done already. But I would ask that you get the basic information, and the stuff that we're going to need is how was the application processed, the date that it was processed. And I could actually send you some of that information. I'll have Giggy send out what we would need for research, but we would need a few examples to bring back to Blue Cross so they would actually work with CMS to get it resolved. I have the cases that we're working on internally that are doing those same kind of things. It's terrible because you're stuck in this cycle of nobody knows the real answer, and then when you do get someone who wants to give you an answer, the answer is, oh, it's going to be 30 to 45 days. Now, Will, another question I would have, is that person medically needy? Because if that person is medically needy, then that raises a whole nother situation, and that would be put more towards the top of the escalation team, shall I call it? Is it someone that's medically needy? Okay. Yeah, we'll get that out to everybody so that way, if you have those particular questions, and it's Will, and we'll send it over to you. You fill it out, and then you can get it back to us, and we'll send it up to Blue Cross, because that's not a rampant problem. The problem is rampant when they're making a change. And what I would advise anybody who's in that situation currently, so you talk to somebody and they call you, on Wednesday of next week or Thursday of next week. What I would advise doing is, at this point, just kind of what we're going to probably have to do is do a whole new subsidy determination, and we'll have some guidance on that with specifics for everybody that we'll send out, because it's just a problem, and no, and it's just a problem. I'm sorry. Sure. Uh huh. Hmm. Okay. So yeah, I mean, there's just so what I'm taking from what you're saying is that you enrolled the policy. They were freaking out because they didn't get the bill. They got a note at the end of the month of February. You got to make your payment, and they were still freaking out because they didn't get a bill until very late, and they want to mail that payment in. Is that pretty much accurate summarizing that? Yeah, that doesn't surprise me. Probably crossing in the mail like that because everything is so new. That's why what I was saying earlier when you close a sale, you give them that 800 number. You say, listen, 3 days from now or whenever you're ready, before the 28th, for example, if it were for that client, call this 800 number, make your payment. Well, I have to wait for the bill. Well, if you wait for the bill, it's unfortunate, but because of this life-changing scenario that's going on here, there are delays in getting the bills and letters are crossing in mail and delivering mixed messages. But there's not really much that everybody is experiencing that. So there's not really much that you're going to see as far as resolution for that, probably until next year. That's going to continue for March and I would assume April as well. So yeah, so just make sure that you have a nice tidy email that you send someone as a thank you email and have all of these things in that email. We've got some examples that we use, but I mean basics. It's got to be thank you for your business. 3 days from now, please call and make your payment. You can use a credit card or EFT. At that time, please try and set up your automatic payment option. Here's a copy of the formulary list. Here's a link to My Prime. Get to Blue Service. Just give them the what to expect next kind of email. And it'd be a little lengthy, but it's a good solution to try and resolve some of these. And that way, Will, if you get someone later on in the line says, "Well, you never told me that," you've got documentation that you emailed it to them or even mailed it to them, whatever you're most comfortable with. So it's kind of a CYA and cover your what on that to make sure that you're doing your due diligence because again, because of this just sheer volumes and then all of the issues that are going on with payments and collecting payments, this is why we're having those problems. So, okay, perfect. You're welcome. When will new cards be sent in non-payment qualifying? So non-payment is not a qualifying event. We talked about that. There is no option to set up reoccurring. They have to do that online. That's Will's question. Hopefully, I answered that as well for you, Will. Just asking about setting up APOs. If an individual bought on healthcare.gov a Blue Select now realizes a limited network or not what they thought they bought, can they rewrite them on another plan? What's the process of doing that? Um, if they've passed their effective date and they've paid, they cannot switch. That's kind of the rule on that. We're waiting for some guidance on from Health and Human Services and CMS if they would be able to stay within a company and within a Meadow plan to make that switch. But as of today, if it's past the effective date and they have paid, they cannot switch. They would have to get a special election from the government to make that switch. But Wendy, be mindful that if that person did that and there was agent involvement from another agency, and if you said bought on healthcare.gov, so let's use that example, you'd be fine, you'd end up getting paid. However, if that was someone who purchased from Mark Carbulano, and then you get them on the phone, and Wendy says, "Oh well, Mark Carbulano sold you the wrong plan, the wrong network. Let me switch it for you," and you switch it, you're not going to get paid. So don't switch policies for members that have an agent that have enrolled because there won't be any payment on that for you if they are currently enrolled on a plan. It's more like a BAF form or a benefit authorization form that we used to do before. The process of rewriting that would be calling the marketplace, seeing if they will issue a special election period due to incorrect information being provided. And once that's issued, you'll get notification with the client, and then you can re-enroll them. Please confirm that a subsidy in Florida is people from 100 to 400% of the federal poverty level. It is 100 to 400% of the federal poverty level. The marketplace clients have a 90-day grace period, sort of. So they don't have a 90-day grace period. They have a 30-day grace period from the time of the payment. All claims will be suspended after 15 days, and no claims will be paid. Blue Cross Florida Blue is honoring a 60-day window for that grace period, but do not play with grace periods with Affordable Care Act plans. Your clients cannot play with grace periods, because if they get kicked out of the plan, they cannot re-enroll. So I wouldn't inform anyone that there's a 90-day grace period, especially with everything that's going on. You've got a 30-day window to make that payment, a 30-day grace period. It's a total 60-day window. Don't even talk about 90 days. 30 days from the time it's due. It's due on the 1st, end of the month. You really need to make that payment. If you don't make it by the end of the month, you're going to have problems. 15 days after that payment is due, claims will be held in limbo until the end of the month. Okay. If that premium payment is not paid, they will be required to pay all of those claims back. I was advised by Agent Services that the 3/1 invoices were generated on 2/18 and mailed on 2/19. Okay, that's great. I don't know if that's accurate or not, but I can check if that's important to everybody. When someone enrolled into the marketplace, they had an income of 105% of the federal poverty level. In the middle of the year, their income increases to over 400% of the FPL, and they don't tell the marketplace. We know the tax credit goes away, and they will have to pay back all of the tax credit. Correct. But what happens to the low copayments, CYD, all that? Nothing. So that policy would stay enforced. There would be no change to the policy, but they would have to pay back any subsidized amounts. Can the government charge a subsidy once amount? Can the government change subsidy amount once they know income made for 2013? So we are estimating for 2014. No, the government won't change that amount until taxes are filed. And the government's not going to just change that amount. It's going to be something that's going to be between them and the IRS. The government's not going to have time nor a process to change those amounts automatically. We've got enough problems with what we've got going on without them doing that. So clients keep on trying to change mailing address on the Florida Blue website multiple times. The system's not recognizing the change. Enrolled, move. November 28th, still does not have ID cards. Bills are sent to the correct P.O. box, but can't get ID cards to be sent to the P.O. box. Any suggestions? No, not really. You're going to have to contact. So basically what I'm assuming you're saying is that they don't send identification cards to the P.O. boxes. They send them to the physical addresses. So what I'm assuming, David, you're dealing with is that someone who they're getting the bills because they use the P.O. box as the mailing address, but they're not getting the ID cards because they're sent to the physical address. I don't know what so they cannot get any mail at the physical address, or I don't understand why they wouldn't be able to get that. But you're going to have to work with membership and billing on getting the identification card sent to the correct place. Otherwise, they should log into My Blue Service and see if they can do it there. I don't know if you're just trying to do it when you say you're trying to change it online. I don't know where that change is trying to be made. Agent Services should be able to address that with you. Member Services should be able to do that. However, if it is an on-exchange program, be prepared to be living through this nightmare for quite a while. The change in address needs to be made both with the government as well as with Florida Blue. That was the guidance that we were given, and unfortunately, it's kind of this. There's no good word for it, so we're just going to leave it at it's a pain in the neck. And we understand, we hear you. You can let your agency director know, David, that this situation is. We can escalate that to the regional director and area manager to see what can be done. I thought there was an option to set up APO for clients. We used to have this option before in subsequent payments. Yes, Joe Ellen, we used to have this process, but this process has not been available since the Affordable Care Act started in October. Due to regulations, we're not able to set that up. The payment systems won't sustain that and won't support it, so therefore we have to utilize this process now. They can set up the APO through the paper APO form that is being given with their bill if they get their bill. So we have those issues, those hurdles. Otherwise, they can use the 800 number to set that up. Will commissions be paid when re-enrolling? Will commissions be paid when we re-enroll those being non-renewed by Blue Cross Blue Shield because those plans are not compatible with ACA? My personal coverage is being non-renewed 7/1. And we have several of those in the same boats. Well, I don't know how you got that notice that your policy is not being re-renewed on 7/1, where you got that document, because I was in a meeting with Blue Cross, and on 7/1 we will have a rate increase, but it will be renewed. As we have told and informed everybody on several calls earlier, you can keep your policy until the end of the year. You will get a rate increase at 7/1 or 8/1, whether it's a Blue Options plan or a Blue Options hospital surgical plan. They will be able to keep that policy until through 2014. And then depending on when that policy was originally purchased, there are talks about being able to keep those policies for the next 3 years, which is great for our clients because 84% of our clients don't even have subsidy eligibility who have a current policy. So them, even with a rate increase, may be better off just keeping their policy. So I don't know where that information came from, Bill, or if it was just past information. If a marketplace plan cancels for non-payment, can a member reapply after the next open enrollment and receive a tax credit if they still qualify? For next year, I think, Tiffany, if you're asking about next year, absolutely. Next year is a whole new ballgame. So if they miss it for this year, you could sell them a short-term medical policy, some other style of policy, and then next year in October, November, when open enrollment starts, because it's scheduled to start November through January of next year. Isn't that wonderful for everybody? So you figure November 15th through January 15th will be our open enrollment next year for the Affordable Care Act. And as a wise man said, they just wanted to squeeze some more holidays in there for everybody. So now we'll miss November, so we'll miss Thanksgiving, Passover, if you're, do that kind of stuff, Christmas, New Year's, and, well, you might as well just throw Valentine's Day in there. That'd be great. Make it till February 14th. Perfect. If a client do not need to tell us income subsidy changes, that's reconciled on the tax returns. Okay, so Lorraine, you need to bring your clients to healthcare.gov, and they need to inform the marketplace of any changes in income which will effectively change their subsidy. Telling you doesn't do any good unless you want to do all the service work, but you must have the client on the phone, and you must report those changes. Okay, so that's between them and the government. Can you speak to commissions? When is Florida Blue going to get commissions straight for exchange policies? This is hurting business and hard to motivate agents to sell when they can't get paid. Will, I would advise speaking with Ms. DeFalco on that. And there's ways to deal with that, but call Gigi and she can take you through some of the pathways that we've used to resolve those issues and keep everybody motivated. So everybody knows, as A&B and with all of our, with all of you that are participating with A&B as our partners, we've done a really tremendous job in enrollments, and you've done a good job. We need to keep everybody motivated because there's lots of reasons to be motivated. Just so everybody knows, the other carriers haven't even paid commissions out. Humana did their first commission run last week. As far as them getting commissions out and paying people, Florida Blue has been providing, some commissions, estimated commissions, and with resolution to be coming in the next month on the next commissions with some makeups there so everybody can be square. All right. So anybody have any other questions? All right, everybody. Well, I want to thank everybody for their time today. We covered a lot of ground, and I hope everybody can communicate any further issues you're having to Mr. Falco, and we'll help you out as much as we can. And then, as our future conference calls, we'll talk a little bit about some other marketing post AEP. And excited. Hope everybody has a great weekend and enjoy. Thank you very much for your time, everybody.